So we'll look at three tests. Three tests, and this is what is known as a thumb to forearm test, the elbow hyperextension or knee hyperextension test, and also the trunk flexion test. So get to look at all of them. So coming for this test, let's look at them. So there are actually three clinical bedside tests, and they're usually used to assess what? Joint hypermobility. They want to see if your joint is too flexible. Okay. They want to see if your joint is too flexible for a normal human being. Okay. So thumb to forearm test is like this. The patient flexes their thumb across the palm and attempts to touch the forearm. So positive results shows that the thumb can reach or touch the forearm. So if you reach and touches there, indicates that the thumb is too flexible. It's hypermobile. The movement is too much. Then for the elbow or knee hyperextension, it could be at the elbow, it could be at the knee. So the examiner checks whether the elbow or the knee extends beyond the normal straight position. So extensions that are greater than 10 degrees become neutral. And significance suggests that there's ligamentous laxity and mobility at those large joints. Okay. Then how about the trunk flexion test? See it? Okay, so that's what we have for that. So for the trunk flexion test, sorry, I'm coming. Trunk flexion test just have to do it. The patient is bending forward at the waist with the knees straight. Yeah, they could be sitting or they could be standing. And positive result is if the palms straight rest flat on the floor without bending the knees. Significance demonstrate that there's so much flexion, too much flexion even. Okay. So clinical context is they're actually part of the Beighton score, which uses a 9 point, to now measure hypermobility. So look at it. Thumb to forearm, little finger hyperextension, elbow hyperextension, knee hyperextension, trunk flexion with palms on the floor. Please, you can pause to look at it, alright? But hypermobility is associated with some conditions in the body where basically your connective tissues are too flexible. Okay, your connective tissues are too flexible.